Lactose intolerance is the inability of adults to digest lactose, which is a sugar found in milk and dairy products, causing side effects. It's due to lactase deficiency or hypolactasia. Congenital lactase deficiency prevents babies from drinking even human milk. In the normal state, in order to digest lactose, it must be broken down in the small intestine into glucose and galactose to be absorbed by the enzyme lactase into the bloodstream. However, in the abnormal state, the absence of the enzyme lactose passes into the colon. Bacteria in the colon can metabolize lactose, and the resulting fermentation produces copious amount of gases, a mixture of hydrogen, carbon dioxide, and methane that causes the various abdominal symptoms. Symptoms of lactose intolerance can be mild or severe depending on how much lactase the body makes. Symptoms usually begin 30 minutes to 2 hours after eating or drinking milk or milk products. If you have lactose intolerance, your symptoms may include gas, bloating, diarrhea, throwing up, and pain in the lower belly. Treatment. Unfortunately, there is no cure for lactose intolerance, but most people are able to control their symptoms by making changes to their diet. Some dairy products, however, such as hard cheese and yogurt, contain lower levels of lactose than milk and other products, so you may still be able to have them. Gaucher disease is a genetic disease in which fatty substance accumulate in cells in certain organs. It's caused by a hereditary mutations in the GBA gene causing deficiency of the enzyme glucocerebrosidase. Normally, the GBA gene provides instructions to produce an enzyme called beta-glucocerebrosidase. This enzyme breaks down a fatty substance called glucocerebroside into a sugar and simpler fat molecule. Whereas the mutation in the GBA gene greatly reduce or eliminate the activity of beta-glucocerebrosidase. Having not enough of this enzyme, glucocerebroside, and related substance can consequently build up to toxic level within the cells. Symptoms of Gaucher disease: bone pain and easily broken bones, anemia, fatigue, nose bleeding, and swollen stomach due to enlarged liver or spleen. Medications. Many people who have Gaucher disease have seen improvements in their symptoms after beginning treatment with enzyme replacement therapy, megalostat, osteoporosis drug. Glucose 6-phosphate dehydrogenase deficiency, also known G6PD deficiency, is an inherited disorder in which the lack of the enzyme G6PD can cause the red blood cells to be damaged and destroyed due to the exposure to some chemicals or during some infections. The G6PD gene provides instructions for making the enzyme glucose 6-phosphate dehydrogenase. The normal functions of the enzyme G6PD that plays a critical role in red blood cells which carry oxygen from the lungs to tissue throughout the body. Glucose 6-phosphate dehydrogenase is also responsible for the first step in a chemical pathway that converts glucose, which is a type of sugar found in most carbohydrates, to ribose 5-phosphate. Factors such as infection, certain drugs, or ingesting fava beans can increase the levels of reactive oxygen species, causing red blood cells to be destroyed faster than the body can replace them. A reduction in the amount of red blood cells causes the signs and symptoms of hemolytic anemia. Mutations in the G6PD gene reduce the amount of glucose 6-phosphate dehydrogenase. This enzyme can no longer play its protective role. As a result, reactive oxygen species can accumulate and damage red blood cells. Treatment. The most important measure is avoidance of the drug and foods that cause hemolysis. In the acute phase of hemolysis, blood transfusions might be necessary. It has been suggested that vitamin E, by virtue of its antioxidant effect, might protect against chronic hemolysis in glucose 6-phosphate dehydrogenase deficiency.